I recall a very heated debate in Slovak media in the second half of 2011 during the revolt of our doctors, when a big part of media and a part of so-called experts on healthcare were repeating and again statements about inefficiency of our healthcare system, and because it's inefficient, we need to reform it, which in the brackets means privatize it. So let's have a look at the expenditures on the healthcare. This is what the OECD in 2010 provides, and WHO have similar data. These are the top 10 countries in terms of healthcare expenditures. And in the second column is a percentage of GDP. So you see that US, of course, is the country that has the highest percentage of privatized healthcare, also has the most expensive healthcare, basically twice as expensive as is European average. When you look at the Germany, France, they have around $4,000. This is in dollars per capita in a parity purchase power. Next one. Now, do the money reflect the performance of the healthcare system? There are few statistics we can look through which we can look at the performance of healthcare system. And one of them is infant mortality rate, and another one is life expectancy. Well, of course, there are more sophisticated, but these tell us something about the healthcare system, especially the infant mortality rate. So when we look at now here, this is the figures that they provide, and these are percentages. I noticed that in Poland or in Hungary, you say that it actually is much lower percentage of expenditures than 7.8 or 7%. Yeah, but somehow OECD in 2010 provided these percentages and these figures. But the infant mortality in individual countries is in this column, and this is the life expectancy, the general life expectancy. And these are United Nations World Population data. Now, when you compare these figures, infant mortality and life expectancy, with the performance of the big countries, several big Western countries, Americans, $8,000, infant mortality comparable to V4 infant mortality, and life expectancy a little bit longer, but not so much to justify 4 times bigger or 4 to 5 times bigger expenditures. Yeah, and actually the performance of Czech healthcare system with the infant mortality. This is a Scandinavian infant mortality. Yeah, this is better than much better than American, but it's better than German, French, or Italian infant mortality. So with 20 to 25% money compared to Americans and half the money compared to big Western countries, V4 medical systems are achieving quite comparable results. So the argument that our healthcare systems are inefficient really does not hold. In Slovakia, a specific argument is, look, Slovakia, more money than Czech Republic, and Czechs have better results. So in Slovak, a small Slovak debate, this would be used, and they would point to we are inefficient compared to Czech system. Well, then we would need to look at the demographic data, ethnic minorities, and some other phenomena, and I will touch upon one of them. Next one, please. Další. Number of physicians. We touched upon this, and this is the number of physicians, the top 15 countries. This is counted physician per 10,000, yeah? So look, I put in the bold some of the advanced countries, Austria, Norway, Switzerland, Sweden. They are on the top, and they have well, Sweden has 38, Norway 42 physicians per 10,000 inhabitants. How do we compare? Next one. Well, Czech Republic is closest to that with 37 per 10,000, 37 physicians. You see, it's a comparable figure to German, Italian, or French number of physicians. Then Hungary and Slovakia are in a similar position. Now, these are statistics from Global Health Facts. This is a source, you will find it. Well, again, when we think about Czechs and Slovaks, I bet, I do not have data, but I bet that 20 years ago we had the same figure, which was probably higher than 37. And Slovakia is starting doctors faster than Czech Republic, partly because many Slovak doctors migrate to Czech Republic. So Czech density of doctors is still relatively high, while in Slovakia it is decreasing fast. Yeah. I am pretty well aware of that. Yeah. And I was quite shocked when I find the Polish data. I was not aware of this. Well, they say 22. You said 2 per 1,000, 22 per 10,000. It's. Well, this is in the company of countries like Kyrgyzstan, Romania, Serbia, Tajikistan, Montenegro, and yes, Japan. But the Japan is a very different culture. Yeah, it's a very, very, very different culture. Well, it's not insurance companies who treat people, obviously. It's doctors. And as many of you repeatedly said, this is very hands-on work. The robots are not going to replace doctors anytime soon, and probably never. And the next one. So, and this is just a few challenges that and there are many more, of course, but I selected a few of them. Well, one challenge that we all face everywhere here is that we have extremely cynical economic elites, and obviously we have a political elites who are nothing else but servants of economic elites. I'm afraid this is true in Italy and in other Western countries, but it definitely is true in the V4 countries. And basically, the sick patient is a bad patient, and the really dead pensioner is a good pensioner for them. Now, this may sound like exaggeration, but we witnessed here in Slovakia 2 years ago a massive closing down of the geriatric departments and long-term care departments, which is exactly, they were closing departments, treating the most expensive patients. Yeah? And, you know, we know that from medical perspective, very quite hopeless patients. Nevertheless, we are humans and we should care about it. Our Neanderthals did it. They care about their old and sick people, so we should probably too. Now, the second big challenge is that population is completely clueless about what's going on. People do not know what every patient or almost every patient or citizen has some negative experience with our healthcare system. And it's inevitable. Once things get to the point where they are, everybody must have negative experience with a doctor who was not nice to the patient and so on. So it's very easy to build on that negative sentiment and to inflate it. What we had here in Slovakia was a hate campaign. I mean, would that be against an ethnic minority, what was done here by media? That would be a concern of United Nations and human rights organizations, and everybody would be scared to death that, well, my God, these are preparing a genocide of Roma or something. But doctors were legitimate by the public subject of such campaign. But it was really brutal onslaught on doctors, the medical profession as such. Well, because people don't understand, they are very susceptible to corporate propaganda. They eat soap operas, and basically we are homo ludens. We prefer to play and not to think. Yeah. The economists, economic analysts, and the journalists who write about this healthcare system are, unfortunately, young and healthy people. So they live in this illusion that they will never ever need doctors. They do not have experience of being seriously sick, and before they have children who happen to be sick, they do not have that experience. Yeah? But they are opinion makers. And plus, they all live in the national capitals, because obviously all media companies are based here, newspaper, TV stations, and so on. So they have no idea about the situation of sick people or chronically sick people, and they have not at all idea about what's going on, let's say, east of Košice in case of Slovakia, east of Krakow in case of Poland, east of Miskolc in case of Hungary. Yeah? They live in Budapest or in Warsaw and in major cities in Poland or in Bratislava. So they think, oh, well, we have plenty of doctors in Bratislava, everything is fine. They have no idea and no interest to find out what is the situation with medical practitioners in periphery. In case of Slovakia, periphery is everything except Bratislava. Yeah? And my last point is that we have very high level of feminization of the healthcare system. In Slovakia, around 60% of doctors are females. And I find out that around 75% of medical students are females. So the tendency is towards even stronger feminization. And that's not good perspective for the fighting capability of trade unions. Because look who is here. Yeah, you are leaders of medical trade union. You all are men. And I recall the pictures of our doctors meeting with Slovak Prime Minister, who happened to be female at the time, and it was all men. Simply to fight, men are more likely to fight than the women, and with more and more higher and higher proportion of women in the medical profession, the strength, the capability to fight for doctors' rights, positions, views may be decreasing in the future. Thank you for your attention.